Hello friends, we are talking today and we are discussing the prevention of cancers. I believe it's a very important topic which mandates further discussion. Cancer is the second highest killer in our world. Millions of people lose their lives every year to cancer worldwide. In India, we get different kinds of cancers, but the geographic disparity notwithstanding, we are dealing with cancers as the second largest killer after cardiovascular disease across the world. February 4th is celebrated the world over as World Cancer Day. These days typically give us the opportunity to discuss with the public and with our professional colleagues about the importance of screening cancer and the importance of prevention of cancer. So general dissemination of knowledge is extremely important as we do our efforts to make sure that we counter this scourge of the disease. Of course, the problem of course is that the sad reality remains that it remains treatment which is expensive. Productivity is lost. A lot of man hours, man years actually are lost to this disease. And based on studies that we have from the Indian subcontinent, 19% of families were pushed below the poverty line because of expenses incurred as a result of cancer. So cancer is not just killing Indians, but it's having a huge economical and a psychosocial impact on Indians as well. Various diseases that are associated with cancer and the treatment of cancer, like depression, like cardiac disease, renal disease, which results as a toxicity of cancer treatment, are also extremely important as we move forward. This is data that we rely on a fair bit. The last GloboCan index came out in 2018, and it shows that during this time, lip and oral cavity followed by lung were the commonest cancer in Indian males, and breast followed by cervix or uterus was the commonest cancer in females in our country. It's data that needs to be taken with a pinch of salt. We believe that data on cancer in general in our country is underreported. From the rural areas, we're not able to get very strong data because a lot of them do not consult a cancer center. Hospital-based cancer registries are only sufficient to pick up the patients who have actually presented to a cancer center, but population-based cancer registries have their own limitations. It's important that we get more data, but for the most part, this is the thing that you need to understand. As you look at the 5 commonest cancer in men and the 5 commonest cancer in women, it's important to know which are the major killers and the major incidence cancers in our country so that we can make directed efforts to prevent them as well as to treat them. So is cancer preventable? Of course. Studies indicate that as many as 70% of cancers happening across the world are preventable. There are something called modifiable risk factors and non-modifiable risk factors. In non-modifiable risk factors, age and gender are important. Of course, no one can control what age they are, no one can control their gender or their family history and the genetic predisposition to cancer that happens in certain families and patients, and a prior cancer history. These are things which cannot be modified. But in the column on the left, you can see that there are modifiable cancer risk factors: tobacco, diet, alcohol, obesity, the lack or the presence of physical activity, infections like human papillomavirus, Epstein-Barr virus are important. The use or the disuse of hormone replacement therapy has also been proven as a significant risk factor for the causation of cancer. These are things we can control. Controlling one's diet, their physical activity, the use of oral contraceptives in females, as well as the importance of curtailing nicotine and alcohol are something which are easily modifiable in our day-to-day lives. That being said, it requires a directed effort in conjunction with your preventive or your treatment-based oncology professional. When we talk about the risk factors for cancer, this is a progress report of the American Association of Cancer Research. You can see what the risk factor imposes whenever we talk about the modifiable risk factors, which is what we are focusing on, and that is the intent of this presentation, so that we can get across to public and tell them what needs to be modified or prevented to be able to make sure that we minimize our risk of cancer. The risk will still not be zero because there are certain non-modifiable risk factors, but we can decrease it to the best possible extent by, number 1, curtailing nicotine consumption. Nicotine comes in chewed and inhaled varieties. Chewed tobacco is a big problem in our country. Not just tobacco, but chewed lime, areca nut, also might or might not contain tobacco, but it introduces a chronic, what we call a chronic irritant inside the mouth, thereby resulting in a higher proportion of oral cancer. Increased body weight predisposes us to certain conditions of the gut as well as females of the genitourinary tract, excess body weight results in the causation of cancer. So make sure that you should adopt a more healthy lifestyle and remain within a target BMI. BMI, or a body mass index, is a range within which our weight should remain to be able to make sure that we don't get not just cancer but other diseases, what we call lifestyle diseases like diabetes and heart disease. So your weight should be within your target BMI. Typically 20 to 25 is considered your target BMI in most populations. Again, it could be separate. A medical professional or a metabolic disease professional would be able to tell you what your target BMI should be. With or without the presence or the help of a dietary professional or a physical activity professional, a gym trainer, you might be able to get to your target BMI with greater ease. So it's important that you realize the importance of maintaining an ideal body weight. Alcohol again is implicated in the causation of multiple cancers. Just like smoking is associated with head and neck cancers, with gastrointestinal tract cancers, as well as lung cancer, in the same way, alcohol is associated with liver cancer, head and neck cancer. When I say head and neck cancer, we mean oral and throat cancer for the most part, as well as gut cancers. It's important to know that alcohol consumption should be limited. What we know about alcohol consumption limitation is that if someone has an alcohol consumption less than 2 drinks 2 times a week, the risk of them developing cancer related to alcohol is lower. We know that dark spirits typically have greater disadvantage compared to, let's say, something like red wine, which actually has an antioxidant like resveratrol in it. There are also other risk factors that are associated. We talked about diet, and diet and excess body weight go hand in hand. But ultraviolet light, especially UVB radiation, is implicated in the causation of skin cancers. There are certain pathogens or viruses or biological agents which cause cancer. Most prominent among them is human papillomavirus, which is associated with throat cancer as well as cervical cancer. There are vaccines now against it, especially approved for cervical cancer. Epstein-Barr virus, which I'm a head and neck surgeon, so my area of specialization involves the diseases that I'll be probably talking about a little more. Cancer at the back of the nasal part of the throat is typically caused by Epstein-Barr virus. We also know that hepatitis viruses also increase our risk of developing liver cancer, notably hepatitis C and hepatitis B, and research is still continuing in that direction. We talked about how we can prevent a significant proportion of cancer cases, and again, this is the same list, but just trying to be more focused towards the high risk causing factors, which is smoking, alcohol, diet, lack of physical activity, and those are the things we should largely be focusing on. Yes, of course, there are other things, including having a high fiber diet, cutting down on processed meats which have more nitrosamines, which are implicated as cancer causing agents. Healthy habits, we talked about again, this is another way of putting it, and this is intended again to be able to make sure that we have an idea about what we need to do to be able to not only foster healthy habits within us, but also within our families. We talked a little bit about the HPV vaccine. Now it is recommended the quadrivalent Gardasil, which is and the Cervarix, which are the vaccines which are recommended for prevention of cervical cancer, and you should encourage adolescent girls in your family to take it, and thus adopt a lifestyle which prevents the causation of cervical cancer, because we know that human papillomavirus, which is HPV related to cervical cancer, has multiple valencies, and it also has multiple variants which can increase significantly or increase more modestly your risk of causing cervical cancer. How we can decrease our risk? We talked about tobacco already, and I believe we've discussed that in fair detail. We want to make sure that we go to our target BMI, and this is also something that we've discussed. Regular physical activity is a very important indicator to make sure that we remain healthy, protected from cancer as well as other diseases. A healthy diet with plenty of fruits and vegetables, avoiding more and more processed food. Limiting alcohol is important, and we talked again about the limitation and a few factors thereof. Skin protection, especially when you're outside, especially if your profession involves exposure to ultraviolet light, it's important that we limit the exposure of the skin to harmful ultraviolet B radiation. Know about your family history. It's extremely important for you to know what family members had what disease, so that the screening programs for cancer can be directed accordingly. Get regular checkups. There are some preventive screening tests which are recommended in individuals beyond a certain age. For example, mammography beyond 40 years in females, and a colonoscopy beyond and a prostate colonoscopy beyond 50 years in males screen for colon cancer. And in addition to that, a prostate specific antigen or a PSA test is something that we generally recommend also. Some symptoms which make you think that you might have this disease. Preventing is very important, but if you have headache, if you have shortness of breath, cough, hoarseness, difficulty in swallowing, loss of appetite, any sore anywhere of the body that does not heal, change in bowel or bladder habits, which means you need to go to the bathroom much more often than you would otherwise do, anemia or decrease in the hemoglobin content of your blood in any of your body fluids, including urine, stool or spit, any mole in your body that changes, that could be a sign of skin cancer. Unexplained weight loss is non-specific, but you need to get it checked out. As regards head and neck cancer, which is my area of specialization, as you can see, there are multiple organs within the head and neck. Keeping it very brief and basic, we need to understand that head and neck cancer does not mean cancer of the brain. Head and neck cancer means cancer of the mouth, throat, voice box and the lymph nodes of the neck. And the risk factors that we talked about apply, the ones that are listed currently, apply a little more to head and neck cancer than of other cancers. Smoking, alcohol and human papillomavirus infection are extremely important causative reasons. There are some symptoms, just like we talked about general symptoms of cancer. In head and neck cancer, if there are blocked sinuses that do not heal, if there is blockage only on one side, we are concerned about that. When it comes to other cancers, any ear pain, difficulty in swallowing, pain during swallowing, difficulty in breathing, which might indicate obstruction of your voice box, are all important. How do you diagnose these cancers? By examining these patients thoroughly and doing the appropriate tests, which generally entail a biopsy and some form of radiology. By radiology, I mean a CT scan, an MRI, a PET scan or any other appropriate investigation. You treat these patients. Being a head and neck cancer surgeon working in this hospital for the last 12 years, we now treat over 1100 new head and neck cancer patients a year. The cure rate for these patients approaches about 60%. That I'm talking about a 5-year survival. So these are eminently curable cancers. They will require either surgery, radiation or chemotherapy or a combination of the above, depending upon what stage the cancer is. So I'd like to conclude with this message, which I hope reaches far and wide in helping us understand cancer, that we use initiatives like this day, which is World Cancer Day, to be able to spread awareness about the common cancers across the world and in our country. We've talked about the risk factors that typically cause it, how they are modifiable or non-modifiable, what are the symptoms of cancer, what are the warning signs, and something that's closer to my area of expertise, head and neck cancers, which are the commonest cancers in males in our country, what we should do to be able to prevent them, and how we can pick them up at an early stage so that the cost of treatment as well as the treatment success rates increase. At Patel Hospital, we are doing a large screening initiative on the occasion of World Cancer Day, in which we will be focusing on a large subset of our population, which is our teachers, who have remained dedicated throughout these last 2 years, doing online classes, themselves commuting to make sure that our students learn. This is dedicated to teachers and their families. We'll be conducting an initiative, going to various colleges, conducting awareness talks, and we'll also be giving them special discounts on any screening tests and free examinations throughout the course of the week. The initiative starts immediately with immediate effect, and it will continue till the 12th of February. So I'd encourage everyone to take advantage of this initiative and use this opportunity and this landmark day to be able to meet your doctors and understand what diagnosis of this disease entails and whatever we can do to treat it to the best of our ability. Thank you.